Many heart attacks don't come with warning signs, but can be equally life threatening. Today, we'll talk about silent heart attack, why it is missed, and what can we do to prevent it or manage it. To talk about silent heart attack, we have with us today Dr. Vinayak Agrawal, who is head of non-invasive cardiology in Fortis Gurugram, will take us through why silent heart attacks are dangerous and what can we do and how the awareness on these can help us. Thank you so much for joining us, Dr. Vinayak. Dr. Vinayak, what is a silent heart attack and how is it different from a regular heart attack that we all know about or talk about?
Yeah, I think that's a very good question because a lot of people do not know this term silent, what it actually means. Now, before I give an answer to that, we must first know what is a classical heart attack look like. So, there are two ways in which a heart attack can present. One is the classical acute chest pain, which is happening in the center of the chest. So we have to understand that any pain which is diffuse, non-localizable. Non-localizable means suppose I say I have a pain here, which I can pinpoint with a finger. It is coming for like a pinprick or coming for a few seconds and going away, keeps coming back, going away in few seconds, less than a minute or so. That will never be or almost never be a heart attack situation. Heart attack happens when there is the coronary arteries of the heart which supply blood to the heart itself get blocked suddenly. And that happens when there is a plaque rupture. So we all develop plaques in our coronary arteries as we age, and those people who have risk factors like diabetes, hypertension, smoking, high cholesterol, etc. And these plaques, when they rupture without a warning.
Right.
And the moment they rupture, the place of rupture in the coronary arteries develops a clot because of the cascading effect of the rupture, and that leads to a sudden occlusion of the flow of that artery. So most of the heart attacks occur because of a plaque rupture and clot formation, which comes mostly without warning per se. So once there is a blockage, the pain will start rising slowly. You would start feeling some discomfort in the chest, and it can rapidly grow into a much more severe pain right in the center, mostly, which is what we call as a retrosternal deep pain, visceral pain, which then may radiate to the jaw, both arms, sometimes towards the back. And there may be associated sweating, profuse sweating, and a feeling of doom, as we call it. The patient usually clutch their chest like this,
Right.
because they can't pinpoint where the pain is. That's a classical heart attack where you must immediately go to the emergency.
Right.
Now, there are sometimes atypical chest pains. For example, the pain may not happen in the center, it may just happen in the jaw, or it may happen in the arms. But then these are relatively rare. The other is what we call as a silent heart attack, where obviously these classical symptoms are not there. And the patient, especially the three group of patients who develop silent heart attacks more: diabetics, long-standing diabetics, elderly individuals above the age of 70, 75 years of age, and women,
Right.
relatively speaking, they tend to have more silent heart attacks. And these may have atypical features. Like, for example, suddenly someday somebody has one or two diarrheal episodes, lose motions, may feel very nauseated, and suddenly a lot of fatigue sets in. If you have a pulse oximeter or a blood pressure instrument, some people will take a blood pressure and they'll see a slow pulse. Normally the pulse is around 70, but right now it's coming out to be say 40, 45 or so.
Right.
These are all subtle signs of heart attack in this elderly diabetic age group. Women, sometimes yes, sometimes no, but we know that women tend to have more atypical symptoms than men as far as the classical heart attack symptomatology is concerned. So these silent heart attacks require a high degree of suspicion. So
Right.
if you are an elderly diabetic, somebody who has multiple risk factors like smoking, high cholesterol, hypertension, diabetes, etc., you must be aware that there is a high risk of heart attacks which can happen. And I should take at least just go and get an ECG done, get a blood enzyme test called troponin, which is a very simple test to do. in the emergency or nearest clinic that you can go to and get yourself checked out. So somebody who's, yeah, like young, third, in their 20s to 40 years of age, who's walking every day, 5 to 6 kilometers a day, eating well, no apparent risk factors, the the risk of silent heart attacks is very low.
Right.
In fact, the risk of any heart attack is very low. So if you have a good lifestyle, less risk factors, you would have less probability of developing a heart attack. The people who have more risk factors, more prone to heart attacks, will have more chances of heart attacks and also more chances of silent heart attacks.
How do the doctors actually identify that the person may have had a silent heart attack?
So it's a very, very important and very pertinent question. And exactly the reason why we say silent heart attack is something which you should know about. Now, any deviation from your usual lifestyle. So, for example, you were somebody who was reasonably agile, walking 2, 3 kilometers a day, and suddenly you realize that I am getting very tired, getting very breathless, even at 200, 300 meters.
Right.
There's something I'm not feeling well. Say someday you go to a party, you come back, you've had a few drinks, and you feel nausea, you feel gastritis. And how do you distinguish that this could be a heart attack? Well, you
Right.
can't. You can't, because this is exactly what we say, that there are a lot of mimickers for a heart attack.
Right.
However, if you feel that that gastritis is not settling down, that nausea is not settling down, say with, pantoprazole or omeprazole, etc., the antacids that we give, then those can be, then you must visit a doctor at the earliest. If you see any deviation in if there is an unexpected fatigue, pulse rate is low, you're feeling dizzy, blackouts, you're feeling fainting episodes, etc., um, not able to even go up to the bathroom,
Hmm.
you're having difficulty living your normal life, especially in the elderly diabetic age group, you must seek medical help. Most of the doctors who are experienced they will be able to guess or at least have a suspicion that something is amiss.
Right.
The whole point is that you need to be aware of, uh, you know, the whole purpose of these programs is to make people aware, not to ignore, symptoms.
Unusual symptoms which you
Unusual
will
symptoms.
hear.
So all that it takes you is to just go to a nearest clinic or your own GP
Right.
who you trust, that this person he can have a quick look at me, this doctor, and can guide me whether I need to escalate it to an emergency level or I need to go and visit a super specialist, a cardiologist.
Are there some scientific tests that doctors do to actually establish for sure that you've had? I mean, you catch it in the, let's say, in a stress echo or the other tests you do, preventive tests. In that, is it easy to pick up that the person may have had a silent heart attack?
Oh, absolutely. That's how we pick most of them, actually.
Right.
So most of the times so I'll give you certain scenarios as to how we catch these patients. Number one is the symptoms, that
Right.
unusual symptoms, which are not classical heart attacks, and they come to us, and we pick it up by doing an ECG, which will usually show some changes which may be suspected of ischemic heart disease.
Right.
We look at the echo, which is the ultrasound of the heart, and we see how is the pumping of the heart, any regional wall motion defects which are there at rest. If we have suspicion, we may go for a CT coronary angiogram. Sometimes, if the patient is otherwise moving around fine, we may do a stress echo. But if somebody has an ongoing symptoms, we should never do a stress test in them. Maybe go for a CT coronary angio if your suspicion is high.
Right.
The third thing which we do is to look at troponin levels. Troponin is a very, very important test. It is a blood test, and we call it high sensitivity troponin.
Right.
It can be either T or I. There are two types of these troponin blood tests called high sensitivity troponin T and troponin I. Some of the labs are doing these card tests. So they take a drop of blood, put it, and if you see two lines in that card test or strip test, then you suspect that you could have a high troponin. But that's a less sensitive way of looking at heart attack. You may miss out some of the heart attacks because the assays or the level of threshold for picking up troponin levels in your blood is much better with high sensitivity troponins,
Right.
which is a blood test. And the turnaround time for that test is about an hour or so. So if you go and give a sample in the emergency within an hour, maximum 2 hours, you will get the report back. So these are some of the three tests that which are non-invasive, which can quickly give you a lot of idea about what's happening. If they are all normal and yet your suspicion is high as a doctor or as a cardiologist, I a lot of times ask them to do a CT coronary angiogram as part of what we call as a rapid triaging to know whether everything is okay.
Right. But these tests, the troponin that you mentioned, these are definitive tests. If a person has had, you would be able to make out from the results that yes, the person has had a silent heart attack.
So both yes and no.
Hmm.
So the troponin has a value depending on how the patient presented. So if the patient presented with, the symptoms that I described, nausea or extreme weakness, fatigue, breathlessness on exertion. So one of the things which I missed talking about was what we call as an angina equivalence. Some
Right.
of the patients just present with significant breathing difficulty, right? They were not breathless earlier, but now suddenly they have a lot of breathlessness even at rest or on walking. That could be a very important sign of silent heart attacks or something which happened in the last, a day or two or last few days. So mainly, so if this kind of a person comes to me and I do a troponin which is high, I would definitely suspect a ischemic heart disease.
Right.
On the other hand, patients who have chronic kidney disease, patients who have severe infection, which is ongoing, somebody who has come to me with sepsis, somebody who has had a very rapid heart rate like atrial fibrillation, etc. They can also develop high troponins. Troponins can go up in a lot of situations other
Right.
than the heart attack. But then clinical say perspective is extremely important. How the probability of troponin depicting a high troponin depicting that it's a silent heart attack is completely dependent on also how the patient presents.
Right.
Having said that, every time the troponin is higher than the normal, you have to take it seriously and make sure that you're not missing out on anything. So whatever it takes, whether I have to go for an angiogram, most of the patients who have high troponins, where I suspect a heart attack or a heart disease, will always go for a coronary angiogram, the conventional one, not the CT, but the conventional angiogram.
Right. So I think you mentioned a number of risk factors like diabetes, hypertension. Uh, how do you lower the risk of these um, risk factors?
So, the very simple way is awareness, which is what we're doing right now. The second stage is to act on that awareness, which is
Right.
to at least have once a year simple tests. Simple tests, you don't have to go for a battery of 100 tests. Simple tests like blood sugar, fasting, and HbA1c starting at 20 years of age. And if you have no risk factor, do it every 5 years, along with the lipid profile. There is another test which is coming up, which is lipoprotein little a or LPA and ApoA to B ratio. ApoA and ApoB, they're also components of lipid profile. So this comprehensive lipid profile, at least once in 5 years, starting at the age of, say, 20, is a very good idea. You don't need to repeat LPA because it's a genetic marker. So if it is high, then you know that this is something which may act as a risk amplifier. Now, other than these two, there are some other tests which we do routinely, which is like the CBC, complete blood count
Blood
or
count.
hemogram. That is just to pick up anemia, and rarely, sometimes patients may have other abnormalities, but that's rare, mainly for picking up anemia. A kidney function test is not a must, can be done every 5 years or so, especially in patients who have diabetes or pre-diabetes, people who have high blood pressures. In
Right.
them, of course, we need to do the basic workup for hypertension, including KFT, urine albumin creatinine ratio, etc. And thyroid function test can be done at least once in 5 years to see if somebody has, any underlying subclinical hypothyroidism, etc. So these are some of the tests which one can do as part of routine workup. Doing a treadmill test or an echo test or an ECG is something which is not mandated. In India, the good part is that you're able to achieve to get these tests done at very low cost, very easily as part of, say, executive health checks or routine yearly health checks. That's completely your prerogative. There are some professional bodies, I mean, like your offices, and there are certain organizations which encourage yearly checkups for all their employees, which is, I think, is a very good thing because you're able to pick up these, diseases like hypertension, diabetes, pre-diabetes, thyroid, high cholesterol levels, etc., much early on, and you can act upon them to prevent heart attacks in future. And when I say heart attacks, I also mean strokes,
Right.
brain stroke. So I think this is something which we are very lucky to be in India
Mm.
because if you were in, say, NHS in UK or in America or in in any other part of the world, they
Mm.
don't do these checkups as part of a routine checkups because it costs money and it is also not part of the mandated recommended test for everyone.
Also, if any individual wants to do it, I think there are long queues before you can have these tests in the hospitals. Yeah. So you mentioned about a lot of how to take care of the risk factors. I think in addition, also will be the lifestyle
Yes.
in order to keep healthy and reduce these risks for any kind of disease. Are the common ones: regular exercise and eating healthy. Anything that you want everyone to know, any last one or two points about silent heart attacks? Because I think the worry is that when you hear, oh, this person died in his sleep, and people think that, and a person sleeping next to uh, the woman or the guy doesn't even come to know, he didn't fret or scream or do anything, and then people presume that maybe he had a silent heart attack. So any last one or two things that you want people to know about the silent heart attack?
Yeah, so we are deviating a bit into a very important zone, which is what we call as a sudden cardiac death,
Right.
right? And now, some of the silent heart attacks. So when for a layman having a sudden somebody close to them having a sudden cardiac death, they would assume it could have had a silent heart attack. So silent heart attack is not really used a term used in cases of like a sudden cardiac death as such, but the causes of sudden cardiac death are very important to understand. And they are pretty much the same risk factors as they are for any heart attack or stroke because it's the same, what we call as a common soil hypothesis, where the same risk factors like hypertension, diabetes, smoking, high cholesterol, sedentary habit, lot of stress, lack of sleep, lack of fruits and vegetables in your diet, all these risk factors, and of course, family history of heart disease, will contribute to your higher risk of heart disease and stroke, higher risk of silent heart attacks, and also the higher risk of sudden cardiac death.
Mm.
The problem is that if you look at India, the average age of India today is 28 years. We are a young nation. The working class of our nation is 15 to 60 years, which is nearly 55% of our population, nearly 75 crore people, which is
Right.
double the population of US. So you can imagine how many are we and how young are we. Yet we are seeing a lot of heart attacks, strokes, heart failure, sudden cardiac death at much younger age than the West. We're seeing it in heart attacks in 25, 30 years of age. And most of these individuals tend to be either smokers, they usually have very bad habits, lifestyle habits. Like for example, they eat out a lot.
Mm.
Junk food is much higher. They don't exercise regularly. They may have truncal obesity, and this is seen more commonly in men than in women. They tend to have more alcohol use,
Mm.
and alcohol we know can precipitate, if not a heart attack directly, but definitely precipitate arrhythmias and sudden cardiac death. Then there is another thing which we are seeing right now is this so-called fad for endurance sports. So you would see these really fit guys who are running in the gym for an hour every day, who run half marathon or marathon runs, and suddenly one fine day they have a sudden cardiac death. Relatively very very fit people, and that kind of uh, shakes everybody out of their comfort zone. That what the hell can we do more than that?
Yes.
The problem is that my body is a machine. When I run, say, I'm not somebody who grew up running 10, 12, 15 kilometers as part of my childhood. I
Right.
started picking this up when I was, say, 30, 35, 40 years of age, when my life became a little stable. By that time, some of the plaques would have formed. Number two is we have very wrong notion of good nutrition. Almost everybody is popping pills, all vitamins, magnesium, etc., which may have different loads of electrolytes. People are popping up electrolyte pills as well as these, the for hydration and for repletion of salt and potassium. They're picking up these tablets. We push them in water and then drink immediately after an exercise. They're popping up a lot of protein. Like I met a young guy who's really fit. He was taking 180 grams of protein every day. Can you imagine 180 grams of protein? And how do you get that kind of protein is by obviously using scoops of, say, not natural protein, but through, say, powders, etc., and the protein powders, etc., that we get. What they don't understand is that you're also putting in a load of um, electrolytes.
Right.
Immediately after a run, you're increasing your potassium levels. You take up a lot of potassium. After that, you're going to go into hyperkalemia or high potassium, which we know is arrhythmic. If it is very low potassium, again, it is arrhythmic. Magnesium, sodium, calcium, chloride, everything plays a role in arrhythmic risks. Plus, when you run a lot, repeatedly, your heart muscle becomes a little thick in a physiological way, what we call as an athlete's heart.
Right.
But some of the people may have underlying hypertension, may have, high cholesterol, which they were not aware of. 10% of the population has familial hypercholesterolemia, which means their cholesterols are high, which they're not aware of.
Right.
Then some of them may have not done anything for 40 years of their life. And then suddenly they got into a program and they want to lose weight and then run half a marathon. Everything puts a load on your heart, which is not accustomed to doing that much activity. And that's when you start seeing sudden cardiac deaths and heart attacks and plaque ruptures in these individuals. So my message is keep it simple. Eat well. Please remember that more fruits and vegetables in your diet, less carbs, more proteins, natural proteins. So, if you were a meat eater, if you're a non-vegetarian, then meat, eggs, simple legumes, soya, your dal, chana, etc. They're sprouts. They're all having the right kind of mix of proteins as well as good minerals and vitamins. So more colors in your food, veggies, salads, etc. should be encouraged. More vegan food should be encouraged over, say, meat and eggs. All is okay as long as you're having balanced food.
Right.
Number two is adequate sleep. I think one of the biggest risks of this generation is that we have been addicted to social media,
Yeah.
right? So I'm not against social media. We all use it. We all enjoy it as well, but then it should be probably restricted to about an hour a day. And one
Right.
has to really strictly go about it because you can just lose track of time when you're sort of what we call as a doomsday scrolling, especially in children and
Yes.
young adults, because it takes away your focus. You can't focus on things because you get used to such dopamine release all the time that you will have hard time sitting at one place and doing an activity and finishing it. And of course, the mood swings that come with it.
Yeah.
So some people will keep scrolling at till 2 a.m. in the night and then they have to get up at 7 a.m. because they have to go to the office. So it's all screwing up their, circadian rhythm and
Right.
normal biological clock. Third is stress. Now, how do you manage stress? We'll all have stress in today's world. The idea is to have a working hypothesis. Keep it simple, let things come to you, don't chase, don't seek validation from anyone, as I always say. Things will come to you. Work hard,
Yeah.
but don't have over-ambitious approach to life. Take it easy, enjoy your journey rather than you will reach where you're supposed to reach, depending on part destiny, part your hard work. The last is, which is very important, is to make sure that you are checking your sugar, blood pressure at least once a year, your lipid profile at least once a year. Seek medical help at appropriate time. Don't keep postponing things till they really go down and you come up with the worst possible scenario. I think that's this in simple ways I would recommend for everyone.
Yeah. Thank you. I think we will stop on this very, very informative words. Thank you so much for sparing your time to talk about this today.
Thank you,
Thank you.
Always a